Hey everyone, my name's Erin. I'm the nurse practitioner at Fit9 Wellness. You just got your peptides in, so let's go over how to do an injection so that way you feel comfortable at home. You should have received all the supplies that you need, so the insulin syringes, your peptides of course, and alcohol pads. So when you get your peptides, there's gonna be a cap on the top. That's gonna need to pop off. Some of them have a sticker that you just simply peel off. Anytime we do an injection, we wanna make sure that we are cleaning off the area with the alcohol pad. So I'm gonna open this up, and for today's injection, I'm gonna use my stomach, and I'm gonna clean off this area, let it dry. So on your insulin syringe, you're gonna see these different lines. The larger lines are associated with the whole number over here. So when you're drawing up your peptides, we obviously want to go to these larger lines. The key here when drawing up your peptide is looking at the top part of the plunger. You don't want to look at this thicker part of the plunger. That's not where we want to draw off. So always looking at the top. When you're ready to draw up your peptide, you're going to simply take off the orange cap and expose the needle. So this is a really small needle and it can go into any kind of fatty tissue. So when we're drawing up our peptides, we want to make sure that our needle is going straight into the center of the circle. The reason for that, it's a really small needle, so it's going to be easy for it to bend if you're going in at an angle. When we're ready to draw it up, we're gonna flip the peptide upside down and you're gonna slowly pull back on the plunger here. So I like to use my thumb as a grip and pull back on the plunger. And again, I'm drawing up to 20 units today. So that top part of the plunger right here is going up to that 20 unit line. When we're ready to go ahead and inject, I'm gonna pull the peptide off the needle. Now it's time to inject. When you're doing your injection, you do not have to jab the needle into the skin. It should really go in nice and smooth. What I like to do is I like to pinch the area that I'm injecting. Then I like to come in at a 45-degree angle. I pop the needle into my tummy using a little bit of force right there, and then slowly inject. As far as what to expect, this is a needle, so bruising is normal, okay? Some localized redness, some itching. Then the question I get asked most often, what do I do with the needle now? So now that we're done with our injection, what I like to do is I like to bend my needle tip back on my countertop and I recap the needle and dispose it in the trash so that way it's not going to stick anyone, especially if you have kids around.